I mean, are there supplements that come to mind that are more dangerous than others?
I am far enough out of the operational world, operational surgeon, that I don't know what the list is. When I was, active duty, we definitely had, kind of our list. I think the, command surgeons are probably a good source to go to, in Army, like the group level, or, equivalent level in the Navy and Marines and Air Force. I think there are probably, because these things change, right? Things come in and out of flavor as people make them popular through whatever social media or other influencers. And a lot of times too, manufacturing companies will change labels. Just when they start to get a bad rap, they'll keep the same ingredients and put a new label on it. And then they're like, oh, it's something new. And it's not really. So I would go to a trusted DoD source for, what the things to avoid are.
Awesome. As far as acute liver injury, is there anything else that we're missing?
It can withstand a lot of insult, hypoxia, heat, toxins, and recover. There is a role for liver transplantation in acute liver injury, but I'm not familiar. I've been out of that world enough that I'm not familiar with what it is. But I think especially with toxin ingestion, right? So especially with like a Tylenol overdose, of whatever deliberateness. And many of them are accidental. One of the worst cases I saw in fellowship was somebody was taking Tylenol, and I think it was a muscle relaxant. It might have been Flexeril, and didn't realize that the two sort of were both cleared by the same enzyme in the liver, and it was sort of like double the effect. And, they were in a lot of pain, and they were doubling down in their dosing. And the next thing you know, they came in fulminant liver failure. Drug overdoses are a very common source of referral to liver transplant.
Oh, yeah. I have no doubt. I mean, God forbid you drink a glass of grapefruit juice. You're done.
I'm less familiar usually with other mechanisms, right? Hypoxia due to shock, thermal due to heat. The patients are just so unstable that they don't make good transplant candidates. So, and unfortunately, for our purposes of our conversation, is really do your best with resuscitation and treating the source, stopping the bleeding, getting the temperature down, doing a really good resuscitation, being super vigilant, and that's all you can do.
It also brings to mind like the concept of, damage control resuscitation. A lot of medics, and even myself included sometimes, is I just need to get them enough, right, to keep a pulse, to keep okay blood pressure, but they're not like fully resuscitating this guy.
And that's why people with well-controlled blood pressure, don't stroke out when their blood pressure is 80, and they don't stroke out when their blood pressure is 160.